and signed by a president. So as we gather, we believe it's important to focus on, what our obstacles are in the way, right? What are the sort of challenges? And while it's true that, we have all of this public support, like we've never experienced before on our side, and it's clear to the sort of, mass consciousness of the country that this Medicare for All movement is the direction of the way that we are going. While that is all true, we still have the obstacle of corporate cash in our way, right? Our congressional system is literally choking on corporate money. It has been for many years, right? And so we believe that we have to turn our attention to that, right? And we have to address that. So these corporations, they have, a strategy of their own. And it's really, really, really important to remember that. And I want to emphasize this point, is that these corporations are not just, doing this like haphazardly, right? They're not just like, creating a fragmented system like they are on accident. This is on purpose. All of what they do is on purpose. And they have a strategy for how to keep the status quo intact, which means we have to have an explicit strategy on how to undo their strategy. They are quite literally our largest opposition. We can think about our legislators as opposition, but ultimately we need our legislators as the individuals to sign on to the bill and support it in Congress, right? So how do we do that? How do we get our legislators to a place where they're choking on corporate cash to a place where they're going to support the bill, right? And I think it's really also important just to accentuate like the scale of what we're doing here, right? So keep in mind that when we talk about passing Medicare for All, we are talking about a true historic shift in the way an entire 1/5, depending on how you measure it, of our American economy functions, right? We're talking about shifting trillions of dollars from the serving the interests of corporate elite and the corporate America, taking those trillions of dollars and putting them back in the hands of the people. And that's huge. There's nothing that I can think of, or there are very few precedents in the United States history where something like this amount of public goods transfer has happened. So part of why, our fight to win Medicare for All, it must be focused on this corruption and this influence that they have on our democracy. Again, these are our true enemies, right? So our campaign plan is focused at the legislators and how much money they're taking. So as the bill gets introduced in February, our plan is to release a list of 10 to 20 legislators or thereabouts, and to identify some of the highest earners or takers of this corporate cash, and label them as targets and start pressure campaigns in these districts. And what our aim to do is to go out and to get signatures, via virtually, when it becomes safe to do so as the year progresses. And if, it's a big if. But as it becomes more safe, we'll be able to do more in-person things. And the goal here will be to share and educate the public at large in these districts how much money these legislators, either at the House or the Senate level, are taking. Actually, sorry, our campaign will be focused on the House. We will additionally come out with Senate targets, but the first round will be just these House targets. But yeah, to identify what these how much money these House targets are taking, educate the public on it, and create a whole pressure campaign around it, right? We're going to be collecting signatures in support of the Patients Over Profits pledge, right? So that saying that I support money going back into public hands. I support money. I support my legislator rejecting this money. The pledge is very simple. It is just aimed at the member of Congress to ask them to reject corporate cash, right? So we're going to go out into the community, collect signatures virtually in support of the pledge for the legislator to no longer take the corporate cash. And we think through, creating these pressure campaigns like this, drawing attention to them, we'll really be able to toxify the money that is coming from corporate America and from the Partnership for America's Healthcare Future. And so I think now is a good time. I'm going to share the link to our website in the chat. So if you want to do that, you're welcome to look at it. I'm also going to share my screen really quickly just to kind of show y'all our website. Give me just a second here. All right. All right. Hopefully everybody can see my screen there. Yeah. Okay. So this is the Patients Over Profits website. Here you can come and sign the pledge, right, to say that I don't want my legislator to be taking this corporate cash. We will match you by your legislator via zip code when you sign the pledge. You can sign it just by clicking up here. Supporters take action, and that will add you to the pledge. Here is also a place where politicians can take the pledge. So another aspect of this campaign is that we are working with grassroots activists all over the country, right? And the idea is that some of these grassroots activists are connected to grassroots campaigns, either at the local county level, at the state level, at the federal level, at any level that elections are happening. People can take this pledge, right? And so we want city council members to take this pledge. We want to do everything that we can to sort of popularize it. And so that is another large aspect of this campaign. It's not as one that we are advertising as much because we're still sort of like working out what that means politically, but it is something that we are doing. And as of the last year when we launched this, we've had like 50 different legislators sign this pledge. Not elected legislators, but people who are running. There were a few electeds in that 50 though. And then, yeah, the other thing that I wanted to show folks, in addition to this website, but I'll kind of just scroll through here. There's a lot of really good information. You know, you can read the pledge exactly. These are some of the organizations that we're working with who has also endorsed the pledge campaign. You've got, the Labor Campaign for Single Payer, Healthcare Now, which is putting on this conference, UE, PDA, Democratic Socialists of America, Be a Hero, Social Security Works, Public Citizens, which is also, doing the resolutions campaign. So yeah, this is we're hoping to make it a big part of what the Medicare for All movement is doing and generating work around over the next year or so. And then the last part that I'll quickly share with folks, because I'm sure that folks are interested. So this is the Partnership for America's Healthcare Future. These are our main enemies. This is the corporate front group that has been created in order to stop Medicare for All. It's quite purposely, its explicit purpose is to stop Medicare for All. It is an amalgamation of all different sorts of groups. You can see here all of the different members that they, just so conveniently list on their website. So part of what the Patients Over Profits campaign, and I'll talk about this in a little bit after I pass it to Blake and when she brings it back this way, is this sort of corporate level of it, right? Who are these institutions? Who are these organizations? Why are city council members and city charters a part of the Partnership for America's Healthcare Future? What does that mean for the Medicare for All movement, and how do we address it, right? I want to talk about those things later in this section. But yeah, so this is the partnerships website. I will also drop this link in the chat so that people can have it. And yeah, so I'm going to pause there and actually pass it over to Blake to talk a little bit about the tracker that Healthcare Now created so conveniently for this campaign. And we are very super appreciative and sorry we weren't able to use it before, but we are so glad that we have it for now.
Great, thanks so much, Riley. Hi, good afternoon, everyone. I am going to go ahead and share my screen. So I hope everyone can see me. Can see the presentation. Oops. So my name is Blakeley Decktor, and I'm here to talk about, as Riley mentioned, the Patients Over Profits donation tracker. As Riley mentioned, this was a tracker that was created by Healthcare Now. I'm a volunteer at Healthcare Now. I've been a human rights attorney for several years, and now I'm a software developer. So I was seeking a project to really pair those two things together. And I found Healthcare Now through an organization called Prog Coders. So this tracker was built by, the people who contributed to it are folks at Healthcare Now and a few of us Prog Code volunteers. So over the next couple of minutes, what I'd like to talk to you about is really the purpose of the tracker, how you can use it, and then what we have planned for the future. So we're going to start with the purpose of the donation tracker. As Riley mentioned, we've been talking about the Patients Over Profits pledge, which asks candidates to refuse to accept donations from executives and lobbyists and PACs who oppose Medicare for all. So this is a way that we can keep track of how, how we know what the politicians are doing. So the donation tracker is really about ensuring candidates who have taken the pledge are abiding by it, as well as identifying those candidates who have accepted donations from flagged corporations and executives, and really being able to hold them to account with an actual dollar amount. So now I'm going to jump into how to use it. I have some slides, and then we'll go over to the actual website and take a look. So this is the website. When you get to the tracker, you'll be greeted with this little blurb and asked to choose a state. So once we choose a state, all the states have these little icons. Sorry?
Oh, hey,
I think you might not be presenting yet.
Wait.
Oh, am I not presenting? I'm so sorry.
Not yet, I don't think.
Oh, whoops. See, I was going through all my slides. Oh, wait, this is not. Sorry about that, everyone. Okay, let's see. How about now?
Yeah, looks great.
Oh, sorry about that.
We see it now, yeah.
Great. Thank you very much. So I don't think we missed anything too dire, but let me just go over this quickly because I think it's, we'll talk about the purpose, how you use it, what's next. Start with the purpose. So really the two things that I was talking about was ensuring candidates who have taken the pledge are abiding by it, and identifying candidates who have accepted donations and actually being able to hold them to account. So now we'll talk about how to use it. This is the this is the homepage of the tracker where you're asked to choose a state. You can then choose your state, and these are the icons that I was referring to. So this little congressional icon here shows that the candidate is an incumbent member of Congress. This next icon here shows that that candidate has taken the pledge, the Patients Over Profits pledge. And then we have these two indicators here to show, this one shows that they have received donations from corporate funding, from corporations funding opposition to Medicare for all. And this one shows that they may have received donations from corporate executives. And we'll talk a little bit about the difference. I will talk a little bit about the difference between those two. And then under the state, you'll see the candidates separated by senatorial candidates, and then the House is below, separated by districts. And we have Democrat, Republican, and other as their party affiliations. So let's jump over to the actual tracker. Sorry about that. And we will take a look. So here's the tracker. I'll include the link to the tracker in both the chat, and also I'll have it on a slide at the end so we can see it. So we'll pick a state, Kentucky, and take a look. And as I mentioned, these are the icons that show you what you need to know, a quick view by the candidate. Something to note is that this is for the 2019-2020 election cycle. So this I'm gonna click on Mitch McConnell. It shows that he's an incumbent. It's just not updated to reflect the post-2020 election. So if you click on Mitch McConnell, you can see that he's flagged as both having received corporate contributions, as well as that he may have received additional contributions from executives that in aggregate exceed $200, which is in violation of the pledge. So this first red X has to do with these corporate contributions. So the corporations listed here that have created these political action committees have donated to his campaign. So that aggregate, that number is here, it's almost $200,000. And if you take a look at these individual contributions, these are what's flagged as orange. And these are coming from individuals who work at corporations that are flagged corporations. So you can drill down into these individual contributions to see who they're made up by. And so the reason these are flagged as orange as may have been contributions by executives of corporations is because if you work at a corporation that's been flagged, regardless of your actual occupation, you're going to be tagged, you're going to be flagged in this list. So most of them are executives, but this could take, if you're really drilling down and trying to get a number of specific executives that work at these corporations, you're going to want to take a look at these and make sure that, it's not just a very generous person who works in the mailroom who's donating a couple $1,000s to Mitch McConnell's campaign. But in general, that's an overview of the tracker. So that's up and available for everyone to use. In terms of what's next, as I mentioned, that was built specifically for the 2019 and 2020 election cycle. So we're coming soon with the 2021, 2022. And to that end, I'm leaving, there's no matter now, but I'm leaving an email address here if you have suggestions or questions. I mean, I'm available for questions at the end of this as well, but if something comes up or you have suggestions for how we can make this tool more useful to you, please let us know. And I'll pop this also in the chat of the group. That's the link to the tracker. So thanks, everybody.
Cool. Thanks, Blake. So now we have a little bit of time. This was a shorter presentation. We wanted it to be a little bit interactive as well. So we do have a quick little breakout session to do with everybody. So I'm going to share my screen and show you all a worksheet. Let's see, where did it go? Right here. Okay. Worksheet. Okay, perfect. Here we go. So in this worksheet, which I will share the link for everybody in just a second, I want to show you when you go into this, because it is a Google Doc, you will be in view only mode. If you go right up here to file, you can click make a copy, and then you can edit this. So when you get this link and you click on it and you go into your breakout rooms, make a copy of this document, or if you want to, you can also just scribble the notes off to the side, but you want to be able to see the questions here. So the idea is that we want people to think really quickly about who their member in the US House and Senate are. Quickly look them up using the tracker. The links can be found right here to get to the tracker. You can quickly look them up, see how much money that they have taken, right, from affiliates of the Partnership for America's Healthcare Future, and how much. And then what we want you to do is spend, a couple minutes filling this out, looking at how much money they've taken. Look for any of the organizations that might be a part of the partnership by going to their website and looking at the organizations who are affiliated with them, and see if there's any in your state. Right? See if there's any of these organizations that have identified themselves as working against Medicare for All in your state, so that they could also be possible targets. And then there's a couple sub questions here that we want folks to think about. The first one is to think about the amount of money that your legislator has taken in comparable terms to something else in your district. The example that we provided here is, the sort of like basic example of public monies, right? How much, if your legislator took $5 million, right? How much money did the hospital system in your district need that year, or did they fall short? Or at public education, how much money fell short in your district? And then compare those two numbers. And then the same thing, we also want you to think through, how are these organizations possibly connected to your legislator, to do a little bit of power mapping. If folks have questions about that kind of stuff, you can throw it in the chat. I'm going to stop screen sharing here and going to share the link for everybody. Share, copy link. All right, and if folks want to click that link and create a copy of this document, we are going to put you in breakouts of about no more than 5 people, and only for about 8 minutes. So we will go into the breakouts, you'll fill the questions out really quickly, have a quick discussion amongst yourselves about the Patients Over Profits campaign, making these connections, and then we'll come back as a group and answer questions for the remainder of time. But yeah, Sophia, if you can start those breakouts, we will go ahead and do that. And then the presenters are going to stay in this room.
Okay, I might put you in the rooms, but I'm going to take you out.
Okay.
All right. Or use some presenters, please do not join the room.
Hi, Claire.
I think it's just a couple of people.
Hey guys, sorry, I was in a room all by myself,
Oh,
which is fine.
I don't have.
I don't necessarily need to do this, Riley.
Yeah, no, that's fine. Sophia, can you see the breakout rooms and see if there's anybody else that's also in a room by themselves? I don't have that capability.
No,
'Cause I'm
that's what I'm doing to make sure.
cool.
I don't know if you caught this, Riley, in the chat, but it looks like folks do want to talk a little bit about ways they might be able to use this to build power. And so I'm wondering, like, in addition to kind of like processing the worksheet that you developed, if we could talk through, you know, some ways to do that, because unfortunately we don't have a lot of experience with it. You know, given that we had to quickly switch horses midstream at the onset of the pandemic. So it's not like we have a lot of concrete examples, but I could see, I just think like, you know, really reminding folks that like our experience has been like, for pretty much like all our members, like no one supports their electeds taking money from the pharmaceutical and the insurance industry. So it's just like, it's such a powerful ask, such a low bar ask of like getting people into this struggle for healthcare justice who wouldn't otherwise.
Yeah, I'll spend a few minutes talking about that when the people get back, and then open it for questions. Yeah. Cool.
I thought it was really great though, both of you. It was so good.
Thank you.
Thanks. Yeah, I was worried about throwing it together, but you know, what are you gonna do? It's great.
I think this is what we do.
Yeah.
Throw stuff together last minute. Blake, your presentation was really great. Thank you.
Oh, that's very kind of you. I didn't realize I wasn't sharing my screen for the first half, but great. I'm glad it worked out in the end.
No, it's totally, I just thought you were like, you know, introducing the presentation and then, so it was fine. It was totally,
Well, thank you.
and it was so amazing that Healthcare Now like loved the campaign so much when we introduced it. They're like, we're gonna develop a tracker. We're like, great. Because one of the issues is like the capacity of like tracking all that and putting it in there. And then as I think it was Sadif was saying, like, then also like we've talked to our research department at NNU about helping us figure out like efficient ways to like make sure that the electeds aren't actually getting donations. Like, how do you hold them accountable essentially? Because then you don't want it to like to lose legitimacy because we're not holding. Yeah,
absolutely. I think that having easy access to real numbers is important. So I just want to say another contributor to the tracker is on the call too. He didn't speak, but Mushfeq's here as well. He did a great job.
thank you both so much. Amazing.
Around 5 minutes before the breakout rooms finish, just letting you know.
Nice. Perfect. Yeah, I think I'll spend just a quick moment transitioning and being like, bring up what Kelly said about how this tracker just came about organically. And this is one of these kind of like big movement moments where, you know, we put out something and another organization puts out something. And that's just kind of, I don't know, the beautiful way that this goes. And then, yeah, I'll take a little bit of time to talk about how this is a great opportunity, regardless if you're in a red, blue, or whatever district, to build power for the movement. Because, you know, we know that across the board, no one likes their legislator taking money like this. So this is a great way to, you know, engage in conversation, to build power. You can use the Patients Over Profits campaign as an extension of your like local campaign, right? So you can use this pledge to garner supporters, to build power, and then invite those supporters to a rally outside of the congressional. So I'm sorry, I'm just saying all this so I can practice it out loud. But yeah,
sounds good.
Yeah. Yeah. Okay. Cool. And we'll do rally, power building, blah blah blah. All right, and then we'll open up for questions because I'm sure folks will have them.
Riley, I was laughing about the question about tracking the California politicians. I was like, oh, because that's no work.
I know.
Now we're gonna have to track all the state politicians.
We should just track all the politicians. We should just do a national tracker at every local level so that we just know how much everyone takes everywhere.
Our team is gonna have to be doing it full time. There will be no organizing. We will just be tracking.
Billboards, tracking and billboards. That will be the whole organizing model. Oh, I don't think I mentioned the billboards thing. I should always say that. Also.
Yeah, no, it's cool. It's cool.
It is. It's really cool that we were going to do that. I mean, I just mean that because it's like essentially the equivalence of a honk and wave, but it is, I mean, in the respects that it's, after X amount of signatures has been gathered and there's been a campaign that's been made. I mean, that is what's impactful about it.
I also think that unelected is not going to win and be on a billboard saying that they take all this money from the insurance industry. I understand the honk and wave thing, but I think it's like it's a bit escalation, more escalation than honk and wave.
The reason we say the honk and wave thing is like in our brains, we've been ingrained to believing that every single time that you do anything, it needs to be regenerative to bringing volunteers in and then making sure that they rinse and repeat a tactic. And the honk and wave does not bring in more people. And so that's why so the billboard in and of itself doesn't bring in more people, but it is powerful. Like I totally agree with what you're saying. But that's where that's like the piece of that we like why our brains, because it's like, but then maybe, I don't know, maybe put the phone number under it and then they call the phone number and join the campaign. I mean, I don't know.
I also think we can build out something, a pretty cool digital campaign around it. No, I hear you though. Like, always this question about like how many new people are we bringing in with the resources that because it's, as Holly reminded me, it's like crazy town expensive to do these billboards, depending on the place. So, it ain't cheap.
Totally. All right.
Okay, it's almost 30 seconds before we bring them back.
Yay. I think this was great timing. I think we got plenty of time for questions. I think this was perfect.
Yeah, I think so too.
All right. Everybody's coming back in. Hello. Looks like we're getting most people back. This is great. Cool. All right. So I'm gonna spend just a couple quick minutes talking and then we'll open up for discussions. But thank you so much. I hope that was fun and interactive. I hope you learned something through that and some good questions came up. I'd love to hear a little bit about some debrief. So if anybody wants to share a debrief about what you all talked about, would love to hear. But yeah, I just want to accentuate a couple more points about this tracker. This is one of those moments where, we put the National Nurses United, we came up with this campaign, we launched it last year, and in the, sort of like true ingenuity of creativity of movements and how they evolve, we put this out. Healthcare Now just like saw it and ran with it and was like, hey, we're gonna need to create this thing. We see the void that needs to be filled, and they filled it. And that's just one of the beautiful ways in which that the movement operates and works. So yeah, just wanted to accentuate that fact. And then yeah, also want to talk a little bit about how to use this to build power, right? So in and of, the pledge is a way to expose your rep and to sort of, create high visibility and pressure on what they're doing. It's also a way, and we should also think about it as a way to build power in the district, right? Regardless of whether you're red, purple, blue, whatever it is, nobody likes the fact that their legislator is taking money from healthcare corporations, and at the expense of patients, right? And so this is a great opportunity to go into wherever you are in the country, to go out and to build the list, build your cohort of folks who are engaged and ready to take action. It's a really easy conversation starter. It's a really easy way to inoculate somebody into the issue. But yeah, with that, that's all that I had extra to say. So if folks have questions, I'm gonna peek at the chat, but we're also gonna use the raise hand feature. You can type stack into the chat, and I'll try and keep a progressive stack as we go. Yeah, looks like we have one hand up. I'm not seeing any initial questions. Okay, so Mike Walsh, I'll call him Mike Walsh and also look at the chat real quick.
Yeah, hi Riley. Thanks for everything with this. My question was, and I think it's come up also earlier, from a consolidation or just like seeing a list of people with the certain icon tags. Is there an easier way to see that, kind of like even if it's just within our state?
That is a great question. I'm going to pass that to Blake and Mushfeq.
Yeah, so Mushfeq, feel free to chime in. I just want to make sure I understand your question, Mike. So what you're saying is to see a full list, for example, of all of the candidates who support the pledge, or in a full list at what I want to make sure I understand what you're asking.
Yeah, it could be supporting the pledge, or if I were to pull up a larger state, it's a lot of names. If I clicked, say, the exclamation point icon, that it would just highlight or consolidate a list of those to click through.
That makes a lot of sense. Yeah, that's a great suggestion. Thanks for the idea. It's not possible at the moment, as you saw, and there are California has a ton of people running. So.
Yeah, so it's not something that's available right now, but keep with the suggestions. What would be useful? That's really helpful, and I appreciate you asking, so we can think about that for the future. Thanks, Mushfeq, for answering as well.
Cool. I'm not seeing any questions in the chat.
Looks like Lucy has a question. Lucy.
Yeah, hi, everybody. I just want to talk about what happened in our breakout session. It was very, very interesting. One of our comrades, I hope I say your name right, Nidhi, she's in Illinois, and they've really been going after their senators, Duckworth and, what's his name? I can't think of his name, to take the pledge and to stop taking this. Right, thank you. And maybe you want to talk about this because it's your experience, but what I want to say about what she said is they've been chasing down these senators, and the senators are basically just telling them to F off. And they're telling them, hey, our suburban, housewives, all these people, they love their private insurance. And that's disingenuous. I mean, they're just lying to us. They don't like their medical insurance, their private insurance. They like their care providers. So I think we need to make that distinction, but we also need to really be very fierce and respectful in our language and call them out and say, look, basically you're lying to us. You're not going to stop taking that money. And that's fine. If you're going to do it, just say you're going to do it because you're desperate and you need the money. And then maybe you need to fix that problem too. So, it's just, how do we have these conversations? And, but that's kind of, for me, what came up. Thanks.
That's awesome. Thank you so much, Lucy, for sharing. I see Amy Arland had her hand up, and then we also have the stack with Ira. So yeah, Amy, do you want to?
Yeah, what was amazing about this tool was the revelation for me, not that my congressperson took money from, you know, healthcare corporations. That's no surprise. His name is Devin Nunes. What was surprising for me was when I started seeing that my employer's name was listed under the individual contributions. And when I clicked on the dollar amount, it broke it down to the actual employees. And that was the shocker for me. These are my union members, my sisters and brothers that have given money directly through Devin Nunes to this anti-Medicare for All campaign. And so what it did open my eyes to is that I have a lot of work to do.
That's awesome. Thank you so much, Amy. I see Ira, you have a question as well.
Sorry, I had to unmute there. Thank you. I think that the tracker tool is awesome. I think it's a super way to amplify our power as grassroots activists, right? However, I also see opportunities. I'm not a developer, so I can't say how doable or not certain things are. All I can do is speak to functionality. Right? I would love to see, I envision functionality added to the tool, build it out, so that there is demographic data that's broken down by the government to Census Bureau, etc., to the census tract level. That's like 8,000 people in a block or a neighborhood. And wouldn't it be great to go after individual Congress members if we could get some of that census tract data kind of packaged up for an individual congressional district, so that we can not only talk about, oh, well, you know, you can save this much, or there are this many lives at stake, but this is what's going on. This is how those numbers relate to your responsibility, your district, your constituents. This is what's happening to families that you're responsible for.
Yeah.
And that data's available if it could be meshed into a version of the tracker tool. Wow, that would be awesome.
Yeah, that's really great. Thank you so much, Ira. And on that note, I just put in the chat there, but for other suggestions that folks have, I think that there might be a lot of them as you guys continue to use the tool and stuff. And, you know, as Blake and Mushfeq said, that we want to update it as we go. So yeah, please send us suggestions or send Healthcare Now suggestions about it. And yeah, they'll look into it as far as, you know, ways to improve it, because that's what it's there for, right? For all of us to use and engage with. And if there's information that might be more useful, that, yeah, we try and find that. All right, and I've successfully lost track of progressive stack as people are messaging me.
So Needy?
Needy, yes, thank you.
Awesome. Hi. So I had a question about the healthcare tracker. I was wondering if it includes all donations, including like any dark money, or if that doesn't get recorded. And I know, so we've been using it recently, so I just wanted to know if like you feel like there are any potential underestimates in there.
That's a great question. So as I understand it, it is all of the money that is shown in the tracker is going to be affiliates from the Partnership for America's Healthcare Future. Another aspect of the pledge that we didn't talk about, or we kind of just glanced over, was it's also for all donations that are over $200, right? Because at some level, we're not targeting, you know, the person who's just giving $50 to their local campaign so much as we are looking for the connections with these CEOs and with these executives and the lobbyists really at the higher levels. It's less to, you know, focus towards workers and more to focus towards the corporations. So I don't think that like other dark money stuff would be on there, but there are other websites where you can find that information that you can find online. I'm trying to remember the name of one of them. Anybody else knows the names? Throw them in the chat. I see a couple more hands. So I'm going to go with Maggie Mills. And we got a couple more minutes here for questions.
I just have a question. I wanted to kind of piggyback on what Lucy said. Came up in our breakout too. I think Christine was saying that she had tried to convince some folks to support a similar tactic, and there's kind of this response that it's going too far or it's too angry, or and I find that that response is delivered a lot to what is, obviously completely righteous anger, but there's sort of this, the defense is that this is unreasonable or over the line. And there is a lot of, I feel like there's a big battle that needs to happen with Democrats who are so embedded in the kind of like, two-party battle that they don't want to hear any information that might disrupt that narrative. And I was just wondering if you had any advice on tactics that way, dealing with folks who are maybe closer to us ideologically, but more resistant to hearing information that's outside of their bubble.
Yeah, I can absolutely try and take that one. Do you have a rep in mind that might help me with more context?
A rep?
Yeah, that you were thinking.
Oh yeah, Madeline Dean. I just did a district organizing meeting for you, and I appreciate your help with that. So, but yeah, she's historically very resistant.
Yeah, that's great. So Maggie's a part of the National Nurses United District Leader Program, where we're doing district interest meetings with legislators across the country to ask them to become original co-sponsors of the bill. And so, yeah, Madeline Dean is a tough rep, right? She's a establishment Democrat, right? We could think about like a Kurt Schrader, Blue Dog Dems type rep. I think that this pledge is a tool in which to use in the community to build power around the position that your rep holds, right? And so by using the pledge and the amount of money as like a method to go out and talk to community members, I mean, that would be like the first sort of thing that I would say. As far as using it for tactics to talk to the rep specifically, I'm drawing a blank in this moment, to be honest, but I think that like I would love to talk with you more offline about it. But yeah, I think I could probably come up with and talk with some of other organizers on our team to come up with some ideas for you. But yeah, sorry, I don't have a more specific answer in this.
So just interrupting, I'm so sorry. It's 12:02 Pacific time. Maybe just time for like either closing remarks or just one more urgent question. And Maggie, I think a big solution is going to be like getting a whole bunch of signatures of folks in your district who support the elected getting on the petition. That's gonna change the tide.
Yeah. And so I see one more, or a couple more hands, but yeah, we'll do one more question and then closing remarks and then out. But yeah, Christine Nelson. I think you are still muted, Christine.
Okay, you can hear me now? All right. We were in our breakout session, which I think is a very good tool for networking. And in that session, she said, I forgot the young lady's name, but she said Duckworth was very, a senator, very favorable for the VA. And I just explained to her that our patient story, because patient stories are good.
Yeah, absolutely. Using patient stories in conjunction with this pledge would also be a great strategy and even a tactic to use in conversations. I totally agree. So I see that there's more questions. I'm going to put my email in the chat because I definitely want to.
So Riley, Sophia and I were mistaken. It's actually 12:15. Thanks, Michael.
Oh, okay.
Thank you, Michael. I'm sorry. I was freaking out. Thank you.
Cool. All right. Well, we got more time then. Cool. Well, let's, yeah, Michael, love the call.
It was self-interested, Kelly. I wanted to pick up on the aspect of the question that was asked about the Dems, right? Because we do also, you were doing this, but let's just be clear. this is ultimately an effort to move the Dems off of fronting for the healthcare industry and to make the healthcare industry as toxic as tobacco became, right? And so this is an internal Democratic Party fight. There's a whole set of party, in fact, probably virtually all the parties are committed to getting healthcare money. Pelosi gets a huge amount of healthcare money. It's one of the mainstays of her fundraising apparatus. So I just think we got to be clear about this. This is so when you're talking about corporate Democrats who take this money, ultimately they either have to back off or be primaried. It's a political fight over that seat and whether it's controlled by a healthcare industry corporatist or by someone for Medicare for all. And so we are in that fight.
Yeah, thank you, Michael. Wayne, see your hand up.
Hello, yeah, Wayne, I'm from Minnesota, and Michael is right spot on. And there's those people who are dug in. I just put in the chat conversation I had with some people in or on a call with people in South Carolina, single payer, and they collected 18,000 signatures in a couple of congressional districts, and that's the kind of it's the legwork to organize ordinary people to say, hey, we're fed up with this. And I don't think there's any amount of lobbying or anything that replaces that. And one thing that we need to do in Minnesota is spend more time with that. And we're gearing up to do that kind of work. I think if it hadn't been for COVID, we'd already be on the process. But after COVID, that's going to be the, as people that are, we have several representatives here who are Democrats who are deeply entrenched with the healthcare industry for good reason. They either need to know that we've got their back, or as Michael said, they need to go, and there's no other way around it. So let's do it. Thank you.
Yeah, could not agree more. And to, Michael's point about toxic as tobacco, and Lucy picked up in the chat. I mean, yeah, that is our goal, right? Create the link as clear as possible. Are you
my house or are you out?
No, I'm out. Yeah, create the link as clear as possible in the community.
You sick or not? Or you mean
no, the mattress. I got the mask on.
Oh, okay.
Folks, make sure you're on mute, please.
Dr. Cohen, you're not muted.
Yeah, I know.
Oh, I'm sorry.
Yes. So what I was going to say is that is the goal, right, of this campaign, right, is to create the clear link inside of the community's mind about the toxicity of the money that they take that from these corporations. And the more clear that we can draw that link, the more clear that it will become to the politicians that it's undeniably the fact that they need to support Medicare for all or get out of the way. And we will make that clear to them in gathering the signatures, in delivering the signatures to them. Another aspect of this campaign, which I failed to mention, will mention now, is that as we set this 10 to 20 goal number, or set 10 to 20 target members, we will also put an amount of a couple thousand or however much per district. It'll change per district based on the ratio or the amount of people that there are in each district. But if we hit a goal of, like, say 1,000 signatures, we're going to put a billboard up inside of the congressional district of that legislator, which also has clear how much money they take, right, with their face plastered on it, so that the community knows and the rep knows that we know, right? And so that's another huge part of this campaign, right? Is to hit that goal and create that billboard. But yeah, that's it. That's the clearest line. This should also be mentioned, right, that this sort of toxicity link is being done by the Sunrise Movement as well. Making they had a similar pledge campaign, and we met with some of them and adapted a little bit of it. And yeah, this is all building on that same sort of line of corporate influence over our democracy as well, right? And yeah, does anybody else want to share any questions? I'd love to hear if more folks want to share about what came up for them in their group, if they're thinking about maybe if anybody noticed any of these organizations are actually in their local communities. I think that one thing, as people continue to look at the tracker and continue to look at the individuals that are, you know, donating to them under their legislator, they'll also start to see some of these organizations that are a part of the Partnership for America's Healthcare Future, and start thinking about how they are connected to your community, right? What does it mean when a Oklahoma City Council or a Chamber of Commerce has signed on or is a partner of the Partnership for America's Healthcare Future? Right there, what does that mean when like 8 to 10, 12 local businesses in some local communities sign on? How do we target that? How do we create a local campaign that exposes their connection to the partnership and to what the partnership is doing? Right. I think that if you could go and create a 15, 20 person rally outside of a Chamber of Commerce meeting to say this Chamber of Commerce is connected to the partnership, which is directly trying to fight against Medicare for all and the health of our communities, that would have a major impact, right? Those chambers of commerce members, those are everyday people. They might not even, understand the connection that they are a part of. And so by bringing light to it, by bringing light to the community, we can work to sever some of those relationships and really undo some of the organizing that the Partnership for America's Healthcare Future has already started doing. But yeah, that's the goal. If there's more questions, see hands. Michael, your hand is up. Feel free to unmute.
Sorry, I forgot to take it down. Sorry.
Okay. Well, oh, Claire, sorry, I was reading it.
Yeah, are you ever going to have that information for people who aren't running? Because our very active committee, we have one of our congressperson, Mike Doyle. He has signed on to Medicare for All, but he never mentions it. He doesn't talk about it in his on his webpage, and I don't know. It might be helpful to pressure him, even though he's not running right now, if we could say, look, we know the reason why you put it on, but we know the reason why you're not talking is because this is the backing you're getting. So will you ever do that? Because I looked at the page and it's all for people who are up for election, it seems. It's not everybody. It's not every congressperson.
I can address this. So we're working on keeping, we just started collecting this data, but we're working on keeping it so that in the future, you'll be able to see data from past elections. So you'll always be able to see if they took money in previous campaigns.
All right, Ruth.
Yeah, so I suggested that it would be good to know what percentage of the total contributions these represent, because sometimes $5,000 contribution, if the budget is $100,000, is significant, but a $5,000 contribution when the campaign's goal is $5 million is totally different. So it would be useful to have that information also.
Awesome, thank you for sharing. All right, well, I'm gonna take this last little 2 minutes to do my ending quick remarks. If anybody else has any questions.
Ruth Carter.
There's a question. Chris Carter?
No, I forgot to put my hand out, that's all.
Okay. All right. All righty. Well, thank you everybody for coming to this session. We really appreciate you all coming here and learning about it, learning about the POP campaign. We hope that you take it back with you to your local organizing, whatever that might be. If you have any questions, again, you can, through my email in the chat there, you can also reach out to our whole team as well. I'll put this in the chat for everyone. You can reach our whole team there, and somebody else will also be able to reach out to you and talk to you about the campaign. But yeah, thank you everybody for coming, and we hope this was useful for you. And yeah,
I just want to, if anyone has, thanks very much, Riley. I just wanted to say, if anyone has any additional suggestions for the tracker, thank you all very much for your suggestions thus far and for using it. It was built for you, so This is really energizing for us who are working on this. So thanks so much, and please don't be shy about future suggestions. So thank you very much.
Hey, thank you, everybody. Bye. I think I should play music on the way out.
I like the way you think, Riley.
Yeah.
Thanks, everyone.
Yeah, thank y'all.